Okay, today's date is October 25th. This is Dr. Foy, a real bona fide medical doctor. In fact, he's been a board certified ophthalmologist and he's retired. And he comes to us from Stockton. And Dr. Foy, for the viewer, would you tell them about your angina and what's happened to you here?
Well, I had a heart attack in August of 11, August 10th, and I had severe angina after that. My angina has essentially disappeared now. And it was functioning at a 25% level, my estimation, and now I'm at 75, looking at 80% function level, able to do things, get around, be active.
Thank you. And what would you ascribe your good fortune, your good results to?
Well, certainly the treatment I've had here, which is the only treatment I've had. The rest of the medical community hasn't done a lot for me.
What treatments would that be?
Oh, Isordil and 3 blood pressure medicines, which I don't have to take anymore, and nitroglycerin. Which
and you don't need Isordil. You rarely use nitro now, correct?
I rarely use nitro. Just take it as a what if I'm having a problem, and usually it turns out to be something else, and the nitro doesn't do any good.
And what treatment have you gotten here?
I've had the ozone, the IV chelation, the PK as you call it, and the IV glutathione chaser.
Okay, for the viewer, the PK is giving you essential phospholipids intravenously,
yes.
And you're getting intravenous ozone therapy.
Absolutely.
And you attribute a lot of your good fortune to that too, correct?
The only thing I've had that's done me any good.
Okay, and you've also had prolozone to your hip, correct?
I've had prolozone twice to the left hip and once to the right hip just today. I've had the prolozone to my chest wall 4 times, which has worked wonderfully well because of costochondritis, and makes my chest hurt, and it's hard to tell that from the angina at times. And I've had my hands treated twice. The hands are deforming from arthritis.
And tell us what's happened to your hip with the prolozone, please.
I've had the treatment to the left hip once, probably 2 or 3 months ago, and it brought the left hip back almost to what I would call normal function. I was able to walk without any pain or discomfort or limp. The right hip was always a little bit of a nuisance, but never amounted to much until the last weekend, when it flared up rather badly. The left hip followed along, and I thought it was a good idea to have them both treated today, and at the moment they're feeling wonderful.
I just completed the treatments on both of them, correct?
Yes, sir.
Is there any pain associated with those treatments?
Well, the pain a little bit if the ozone spreads beyond the level of the procaine, but it only lasts a minute or so, and after that you're in a happy land.
Thank you very much. Dr. Foy, may I post this on YouTube?
Be my guest.
Thank you. Last thing, Dr. Foy, you came to us because you read my newsletter, Second Opinion. Is that correct?
Yes, sir. I've been reading it from the first.
How many years?
Oh, as many years you've been publishing, probably a little longer, including your predecessor's time, but I always enjoy it because it has most information in it, cover the territory very well.
Thank you. You care to comment any more on the newsletter itself?
Well, enjoy it and look forward to it every month.
Thanks so much. Bye-bye.